Again, let me welcome everyone to our webinar on taking on the challenge of unsubmitted sexual assault kits. This event is co-sponsored by the National Institute of Justice and Government Innovators Network at Harvard Kennedy School's Center for Democratic Governance and Innovation. Our leader is Bethany Backus, a social science analyst at the National Institute of Justice. Beth has been actively involved in the two action research projects being discussed today and manages NIJ's program of research on violence against women. That'll be starting us off today.
Thank you, Jessica. I'd like to welcome you all to today's webinar. We are very excited to be on our two funded projects out of Detroit and Houston. First, I would like to thank my NIJ colleagues, Catherine Browning and Katie Gresham, in coordinating this webinar. We are especially grateful to Harvard's Government Innovators Network for hosting today's webinar. On our list today are Dr. Bill Wells, a professor at Sam Houston State University, and he is one of the research partners on the Houston Sexual Assault Kit Action Research Project. Dr. Wells oversees the law enforcement aspects of this project, including file reviews of cases where kits have been tested. Rebecca Campbell is a professor at Michigan State University and the lead researcher on the Detroit Sexual Assault Kit Action Research Project. Dr. Wells has been responsible for all aspects of Detroit's research component, including interviews with all partners and data collection related to the cases selected for testing. Dr. Armendariz is a professor at the University of Texas at Austin and is a research partner on the Houston Sexual Assault Kit team. Dr. Armendariz oversees the victim components of the study, including victim interviews, focus groups, and notification processes. Of the Houston Police Department is one of the leading partners on the Houston project and has been instrumental within the police department in implementing some of the changes that have come about or been recommended as a result of these projects. I thank today's panelists for their dedication to this topic and the work they have done to pave the way for the rest of us. Providing a brief overview, and then we'll be turning over the presentation to Dr. Wells. Justice is a grant funding agency that focuses on the research, development, and evaluation of criminal justice topics. The science offices focus on technology, forensics, and the social sciences. The assault kit work out of NIJ is a collaborative effort between our forensics and social science offices. The primary goal of the Institute to provide knowledge and tools to the field and partners at the state and local levels. The issue of untested sexual assault evidence has been a focus of the Institute for several years. Unsubmitted evidence has been found across the nation in jurisdictions large and small. It is obvious that this is a national problem, and we need to better understand the extent to which evidence is not being submitted and why it is not being submitted. Also, we know from our work in New Orleans, Los Angeles, and other cities that jurisdictions do not necessarily have the infrastructure or resources to address a large quantity of unsubmitted evidence, nor know the best way to tackle the issue. We identified a need to better understand this issue so that we can provide tools, information useful to jurisdictions across the United States that are having some number of unsubmitted evidence. These tool information are not limited to just submitting evidence, but in enabling jurisdictions to comprehensively address this issue. It includes, but is not limited to, a proper audit of kits, development of appropriate victim notification protocols, creating investigation protocols and policies, and enhancing communication between the major players, hospitals, laboratories, police departments, prosecution units, and advocacy and victim services. These questions and developing resources, in 2011, NIJ funded two action research projects that you will hear about today. These two projects have been a major undertaking of NIJ's forensics and social science divisions and have involved the partnership of other federal agencies, including the Office on Violence Against Women and the Office for Victims of Crime. Then continues to conduct intramural and extramural work in this area and coordinates widely with other federal, state, and local agencies on this topic. Two projects and present preliminary findings and recommendations on many of the questions plaguing jurisdictions encountering some level of unsubmitted sexual assault evidence. We have an audience today spanning many fields, including crime laboratories, police departments, sexual assault nurse examiners, victim advocates, prosecutor offices, state, local, and federal government officials, and national organizations. Thank you for sharing your time with us today. We do our best to provide you with a comprehensive overview of the projects and discuss some of the resources and information stemming from the project. Your questions throughout today's webinar using the question and answer function that Jessica described earlier. I will now hand it over to Dr. Wells. Thank you.
Thanks, Beth. Good morning to everyone. It's a real pleasure for us to be able to speak with you today. I'm trying to advance there. It's a real pleasure for us to be able to speak with you today about our projects in Detroit and in Houston so that we can share some of our findings and some of the lessons that we learned, as well as talk about the process that we've used. So when we were planning for this webinar today, our group decided that it would be important for us to begin with a discussion and a brief overview of the general approach that we took with both of these projects. And what I'm going to describe to you before our other panelists talk about the substantive findings and changes that have taken place in both jurisdictions. The approach that NIJ requested from our projects and that we used in Detroit and Houston is known as action research. And this is a little bit different from a traditional BIC research model and even from a generally accepted applied research model. There are four basic components of action research that I'm going to talk to you today a little bit about. But one of the overarching goals of action research is to build long-term partnerships between agencies, including researchers, and to build research capacities with the agencies that are involved in these projects. One of the core of an action research model is participation. And from the very outset, both of these projects involved a very strong participatory component. Both project groups engaged multidisciplinary groups in many of the tasks that were involved, I said from the very beginning. So this is an example, or this is the Detroit Project Group, and they involved the Wayne County Prosecutor's Office, Detroit Police Department, Joyful Heart Foundation, YWCA. The Crime Lab was the Michigan State Police Forensic Science Division. The same program that was represented is Wayne County SAFE. From the state level, the Prosecuting Attorneys Association of Michigan was represented, the Michigan Domestic Violence Prevention and Treatment Board, and then obviously Dr. Rebecca Campbell from Michigan State. In the Houston project, the Houston Police Department Special Crimes Division, the Harris County DA's office, Memorial Hermann and Harris Health Systems were our SANES on the project. Community Advocacy Agency was the Houston Area Women's Center. The Houston Forensic Science Center was the grant recipient, and then our researchers out of SANE Houston State and UT at Austin. And really one of the real powerful things about these multidisciplinary groups is it allowed for greatly enhanced communication that generated shared developed understandings of the nature of the problem and the nature of the responses that should take place. A core component of action research is the diagnostic function. The purpose here is to understand the situation as it exists in the local context. So both groups believed it was very important to understand the nuances of the situation before rushing in to take action. We wanted to understand the situation so that we could craft responses that stood the best chance of succeeding. So we didn't begin with assumptions about why this problem developed or what we should be doing about it. We took the time to collect data, prepared carefully for our responses, and we think this represents a smart and informed approach to the situation. These projects were never about just collecting data, just analyzing data and engaging in academic exercises. We didn't want to just sit around the table and talk. The purpose here was to understand the situation and then implement responses that could lead to successful outcomes. And you're going to hear about that from our other presenters, because this research project was about both being smart, collecting data, but then also bringing about change. aspect of action research that I want to describe for you is evaluation and modification. So both projects have entailed monitoring functions, and this allows us to make changes as they're needed. So the overall orientation here to this evaluation is improvement-oriented rather than judgment-oriented. So we wanted to understand the strengths and the weaknesses of our reforms so that then we could go about the process of tweaking them and setting them up so they could bring about the results that were intended with the reforms. With that overview, now I'm going to turn it over to Dr. Rebecca Campbell at Michigan State, and then you're going to hear from a couple of more folks who have worked on our Houston project so you can learn more about the substance of what we've been finding, what we've learned, and about some of the changes that have taken place in both jurisdictions.
Okay, thanks. Good morning, everyone. This is Rebecca Campbell. So to have an opportunity today to talk to you about the Sexual Action Research Project in Detroit. I'll begin by telling you a little bit about how Detroit realized that it had a problem of tested sexual assault kits. In 2009, representatives from the Wayne County Prosecutor's Office, Michigan State Police, were invited to tour a Detroit Police Department property storage facility. It looked like. That is an abandoned parking structure, or it had been until the police appropriated it and used it as an overflow storage facility for crime scene evidence from Detroit. So walking through that parking structure and looking at all of the evidence from different crimes that had amassed over the years, one prosecutors described what happened next as this. He said, walking through, and I see these like steel shelving units with boxes, and I say, what are those? And said, those are rape kits. And I said, rape kits? What are all those rape kits doing here? I estimated 10,000 or more. And I asked, are they tested or untested? And the officer said, I don't know. So long after something like that, before you end up with something like this, landing in the media, Detroit Free Press, County Prosecutor Kim Worthy wants an independent investigation into what she says may be thousands of kits holding evidence of possible sexual assaults that were found in a Detroit Police Department evidence storage facility. To her request for an independent investigation was, well, pretty much this response initially from law enforcement. So we're able to work together to bring together researchers and practitioners at the local, county, and state level to develop an action research project. In the Detroit site of the Action Research Project, we had three primary goals. First, to determine the scope of the problem. Just how many kits do we have in Detroit, and are they tested or untested? Second, to understand the underlying causes of how and why this happened. And third, develop and evaluate solutions for testing kits and for victim notification. In the webinar, I'm going to be focusing on all three of these, but for solutions, we'll be highlighting just testing of the kits. Okay? I'd like to begin by talking a little bit about the scope of the problem in Detroit. Back to this quote that I just showed you a moment ago from the prosecutor at the end. It says, they tested or untested, and the police officer said, I don't know. How not know? How can a law enforcement agency not know why they have a large number of untested kits? One of the things we realized very early on in our project is that it's actually pretty easy not to know. Law enforcement agencies, they have a computerized police property database that's entered into the property system. They may not have a testing database that tracks when rape kits are submitted for testing and what those forensic results may be. These databases may or may not talk to each other. They may not be complete and accurate. Well, what we found in the Detroit site was that the police did have a property database that was reasonably complete and accurate, but testing was tracked separately in an Excel spreadsheet. So it was not possible quickly and easily to be able to determine how many kits and entered into property, and of those, how many had actually been submitted for testing and what those results were. So the depleted state of the IT infrastructure in Detroit, we realized that the best way, kind of the only way to truly know how many rape kits we had in Detroit was to pull them out, each and every one, and count them one by one till we knew exactly how many kits we had in police property. In a complete census, we found that there were 11,304 sexual assault kits in police property current to November 1st, 2009. 30 years, from 1980 to 2009. They included pediatric patients, adolescent patients, the vast majority of which were adult patients. 4 of those kits had been previously pulled as part of a pilot project funded by the Office of Violence Against Women, which was instrumental in getting some testing cost projections for us. 10,904 kits. Approximately 2,400 of those kits had a laboratory ID number, indicating that at some point they had been submitted to the lab. We weren't sure exactly how many had been tested for DNA specifically, but at least they had an ID number. But left 8,505 kits that had never been submitted to the lab. So how does that happen? How does a jurisdiction end up with over 8,000 untested sexual assault kits accumulating over 30 years? The second component of our project, we wanted to do some research to understand these underlying causes. How and why did this happen? We took a systemic approach, and by that I mean we started from the position that this is a problem rooted in long-standing relationships within and between organizations. You don't have 8,505 kits sitting in police property because one person or one organization didn't do its job. This was a systemic failure. So the system I'm referring to here. We certainly have what's happening within the police department to consider. We need to consider what happens in the process of police submitting a kit to the crime lab. We understand how the police, the crime lab, and the prosecutor's office work together as 3 interrelated components of the criminal justice system. We also need to understand what was happening in the medical system over the 30 years that these kits were accumulating. What was happening in Detroit hospitals over this period of time. We need to understand from the survivor's point of view what was happening over these 30 years in terms of seeking exams and reporting the assault. What was happening in victim advocacy and providing support to those survivors and advocating for social change across these systems. Research component, we did in-depth interviews with representatives from all of these organizations, past employees, current employees. We went to the highest levels of each of these organizations and to frontline practitioners. We did extensive review of archival documents. We reviewed 1,268 police reports associated with unsubmitted sexual assault kits. Bring all of that data together, I want to share with you what are our key findings about what was the systemic breakdown that made this problem happen. While looking at within the police department, what was very clearly in police reports was widespread disbelief and victim blaming among law enforcement. In a nutshell, they did not believe the victim, so they did not submit the kit for testing. More commonly, when we looked at the police reports associated with untested kits, was text like this. Not really a rape, it's a deal gone bad, meaning that they thought the victim was a prostitute. What do you expect being with him, knowing that him is a convicted felon? She's lying to cover something. She's not acting like a real victim. This is a he said, she said thing, and why was she there in the first place? So it's very clear cut in the written documentation the extent to which law enforcement didn't believe victims. And the financial resources in Detroit, which have not been good, as many of you know, they did not have training, education, and supervision throughout the years to challenge these beliefs and to try to remedy these practices in the investigation. This key factor we found that was a key cause for this problem was quite simply there was no policy or protocol regarding kit testing. So the decision of whether kit would be tested or not was kind of up in the air, but largely left to the discretion of the police. But being left to the discretion of the police, given what I just showed you regarding their attitudes, meant that many of them were not going to be submitted. A factor we found as an underlying cause is that in all of these different organizations as part of the legal system, they had drastic reductions in their personnel over time. They literally did not have enough people to be able to process the number of kits and reported sexual assaults coming in. So, for example, the Detroit Police Department Crime Lab had 2 DNA scientists. Sounds low to you? It is low. It is actively low. A crime in other cities with comparable crime rates and populations, we would expect to see 6 to 14 DNA scientists, and Detroit had 2. Detroit Police Department Sex Crimes Unit went through a 50% reduction in their staffing levels over the time that these kits were accumulating, not once, but twice. And the prosecutor's office also faced staggering budget cuts, and they were able to staff a specialized unit for sexual assault until very recently. A factor for the development of this problem was that there were numerous changes in leadership and supervision, particularly in the police department. Over the 20 years that most of these kits were accumulating, the Detroit Police Department had 9 different chiefs. Average tenure was about 2.2 years. This is a much higher turnover rate than what you would expect nationally. In size, we would expect turnover would be about 3.5 to 4.5 years or 5 years, and turnover every 2.2 years. The reason why this is a factor for the development of this problem is that every transition in chief trickled all the way down to the supervising unit of the sex crimes unit. So they had a new supervisor on average about every 2 years, making it very difficult to realize that there was a problem and being able to implement any kind of change to address the problem given the constant turnover. Technical system. We also found that was a key reason why kits were accumulating. Good medical forensic exams were not available in Detroit until 2006. They did not have a same program until 2006. So historically, the kits were known for being of unknown forensic adequacy. And ER doctors would often tell police, hey, here's the kit. I don't know if there's anything in it or not. I don't know if it's going to help you. So with that kind of message from the medical system, it's not a surprise that law enforcement was not eager to test all of these kits, given that the doctors themselves said, I don't know that there's anything useful in here. However, the same program was established, and they had high-quality exams and highly qualified and trained practitioners. There was a significant increase in the likelihood that a SAC would be submitted for testing. Now, what was happening with advocacy? Well, not much. Community-based advocacy services were pretty much non-existent. Indeed, over the vast majority of the time that these kits were accumulating, Detroit had one community-based advocate, one person to help survivors through the system and to advocate for change in these systems. So as a whole, where does this leave survivors? Much on their own. So look at this we've identified some key risk factors, or in other words, what's happening in your jurisdiction, and are you at risk for developing this problem? What's happening with respect to the investigations? Do you see victim-blaming beliefs and behaviors? Do you have a policy on sexual assault kit testing? Do you have sufficient personnel in the crime lab and in law enforcement? Do you have stability in leadership? Do you have community-based advocacy? And how are the intercollegial relationships between organizations in your community? Find a bit about some of the solutions that we developed in Detroit based on understanding of the underlying causes. We knew we needed to get as many of these kits tested as possible, but Detroit did not have the resources at the time we did this research project to test all of them. So we were only able to test a random sample of about 1,600 kits. Now, at 1,600, in practice, 1,595 were tested and reviewed. And here's what happened when we sent these kits. Now, remember, these are kits that law enforcement said, no reason to test these. These are he said, she said, there's no crime here. Well, what happened? When we sent them in, 785 of those kits had a profile that met state or federal requirements for entry into CODIS. 49% CODIS entry rate. That there were 455 CODIS hits. The CODIS hit rate of 58%. So just 60% of the profiles that went into CODIS came back with a hit. And those hit to felony crimes in 23 different states. Digging to try to understand whether serial sexual assaults on our hand. And here we used a very straightforward but conservative approach to measuring serial sexual assaults. We looked at what the qualifying offense was for the CODIS hit. What got the offender into CODIS previously was a sexual assault, and it matched to our sexual assault kit. We called that a serial sexual assault. We had 28% serial sexual assault rate in this project. So research suggests that we had a large number of kits. The reasons why that happened pointed to systemic breakdown, and as we started testing the kits, it became clear we needed some serious reforms because we had a lot of new cases that needed to be implemented. Some of the changes that happened in Detroit stemming from this multidisciplinary action research approach. What's different now in Detroit? Many things, I'm happy to report. We dramatically improved communication and collaboration between all components of the legal system, medical system, and advocacy organizations at the state, county, and local level. See that the organizations are working on rebuilding their personnel levels. The Detroit Police Department has made significant efforts to increase their staffing levels in the sex crimes unit to be able to attend to these cases. Funders have dramatically increased their funding for victim advocacy. They've instituted 4 new community-based advocacy positions just in the short time of the Action Research Project. We all know that the agencies in Detroit and the state have made a commitment to testing the kits. So the Detroit Police Department very quickly created a new policy stipulating that all current sexual assault kits would be submitted for testing. And the group worked together to secure $4 million in funding from the State Attorney General's office to all previously unsubmitted sexual assault kits. So even though we tested about 1,600 in this Action Research Project, we've been able to go back and submit all of the other ones for forensic testing. To keep them from happening in the future, organizations involved in the Detroit Sexual Assault Kit Action Research Project worked together to create and introduce new legislation. I'm happy to say that Michigan Public Act 227 was passed by both houses of the Michigan legislature and signed into law by our governor, requiring that all sexual assault kits from this point forward that are released by victims for testing must be submitted to a forensic laboratory for testing. This is a new state policy, statewide law. And finally, again, the idea of trying to prevent this problem from happening again, we're developing a pilot project with UPS. It became very clear to us that it was hard to know where a kit was. And we all scratched our heads and say, how is it possible in this day and age when you can go on Amazon or any number of online retailers and order something and know exactly where that order is, but a victim or a service provider wouldn't know where a kit was? That's a problem. And UPS agreed that this is a problem and has been very kind in providing pro bono assistance to our community in developing a pilot project. This would be tracked from the moment that they were collected by the healthcare provider all the way through the system. We see a lot of changes in Detroit stemming from the Action Research Project. And our report of this project will be coming soon in 2015, and I want to take just a quick second to preview for all of you what will be in that report. A step guide for how to conduct a census of police property, develop a sexual assault kit testing plan. We will share more detailed results regarding our testing and our recommendations for testing. We will talk how to create a victim-centered, trauma-informed victim notification protocol, as well as a sample protocol for folks to look at. We will share our evaluation results regarding that notification protocol. And finally, empirically based recommendations for improving policy, practice, and prevention. So thank you for your time and attention today in learning about the Detroit report. I'm going to turn it over to my colleague Noelle, who will be able to tell you more about the Houston site.
Good morning from Texas. I'm really glad to be part of the process. And what I'm going to do is we set up my time is to tell you that we've purposely, as a group, sandwiched what I'm going to present about the notification in between Becky's presentation and Mary's presentation on purpose. And that is to tell you where our philosophy is, both for Detroit and Houston, the importance of action research and a collaborative approach, but also to put victims at the center of this issue as other communities take it on. So that's part of the reason we did this. And after I give we've done in Houston specifically around victim notification, and you'll get to read Becky's report when it comes out in 2015 about how Detroit has about this issue, then you'll be able to the issue for yourselves in your own community. Okay, let's see if I can forward slides here. So the hold on one second. There we go. So what I'm going to do is just talk about this piece for Houston. We did a lot of other research, and Chief Lynchke is going to talk about that, a broader scope. In Houston is we wanted to be able to put victims at the center of our research. So we were going to ask 3 questions around victim notification specifically. When and how victims wanted to be notified once we started testing their kits. What did advocates have to say about notification processes? What could our interdisciplinary team add to that effort? So I'm going to talk about this issue specifically. So what we found out, I'm not going to go into the methodology so much. I'm going to deep dive into what evolved from our products or our outcomes. You'll find more about the methodology as we produce the report. What we found was, with regard to notification, was that when we interviewed victims who had untested kits, is that they wanted choice and control. They thought notification should be flexible, had the right to know. It was across the board. Some people said they wanted to know. Some people said they didn't want to know, so it'd be a thoughtful notification. We also knew from past research, from like Dr. Campbell's research and other past research, is that letters were not a good idea because you never knew where that victim was in her or his life. So that's why it had to be flexible, and that follow-up advocacy was critical, and that advocacy had to look somewhat different than how it was currently developed in law enforcement systems, in large part because the systems were overwhelmed, and we were getting ready to test kits and notify people about historical sexual assault crimes, and that might look different for victims who had maybe set aside or put aside that trauma and had, as Becky said, maybe some bad experiences with law enforcement in that first reporting of that crime. So what Houston came up with was, from this research, was 5 strategies. And I'm going to talk about these first 3, although we'll talk about eventually all 5 of them in our report. The first is what we came up with. We're calling this the complainant notification protocol, and this is on our website. We're calling this complainant notification because it resides in HPD, Houston Police Department. And this really outlines specifically the investigation and notification procedures that now Houston Police Department has taken on. It is a step-by-step notification guide. It is victim-centered and trauma-centered. Really tells the police department in what situations that that victims should be notified with regard to testing. So when the police department would contact and when they wouldn't contact. And I'll talk about the ways in which victims can be engaged themselves. The idea, the philosophy behind this, going back to what victims told us in interviews, is that it will increase their comfort and their re-engagement, but decrease their trauma. So the second piece was that we would want the victims to be more comfortable with re-engagement. And so the second strategy is around the implementation of a justice advocate, which has been a critical piece to our strategy at HPD. And this might sound similar to a victim advocate in the Houston police, in any law enforcement jurisdiction, but actually this justice advocate is situated differently. So I'm going to move through this relatively quickly also. We looked at this specific strategy about how the justice advocate, who's a social worker, impacts investigations. And what we know is he can impact how the victim participates, re-engages, how the victim feels safe and different in that re-engagement, and increase comfort level. And these were, from a research standpoint, a empirical standpoint, how we reduce re-traumatization. So those have been really important pieces. We also know, and this has been a really very important part of what has been a really positive unintended or intended outcome, is that it's been very positive for investigators. So this victim justice advocate, rather, is situated or embedded in the unit that deals with sexual assault, and is really the liaison between the victim, the investigator, and the community. And so it's situated to explain what might be trauma looks like bizarre victim behavior to an uninformed person about sexual assault trauma. And so investigators become more sensitive to sexual assault crimes and victim behavior. And so it adds this bridge that was not happening before. So as Becky talked about before, is that it doesn't want to cooperate, it's actually trauma. It becomes more trauma-informed when this justice advocate is able to give alternative explanations for behaviors. So that's been a very, very important piece of what we have done in Houston. There have also been, as I mentioned, some systems outcomes that have been critical, and this justice advocate is situated in this way between the community, and so there's been this liaison who is community-based, who is able to pick up the phone when a case is not going well and talk with the justice advocate. The justice advocate does not have confidentiality as the community-based advocate with a victim. So it's important for us to keep that confidentiality situated with a community-based advocate and this advocate having the access to case information. So there's been important developments with regard to that. So the second strategy. The third strategy that we developed was this call line we call SAIL, the Sexual Assault Information Line. This was the way to give our victims who live in Houston the complete power to call in, regardless of the testing outcomes, the power to call in when and how and where they wanted to find out about their results. What happened in Houston was we got to all policy in the state of Texas and in Houston specifically. And so this allowed us to put out information about how victims could re-engage when it was comfortable, how it was comfortable about their results. So this came online. It's actually both by email and by phone, and it's bilingual, Spanish and English, and operates as you see on those slides. So those are the ways in which we participated, at least in those specific ways for the team. There's lots more data about victim notification, the experiences that have been important. The last thing I'll end with before I turn it over to Chief Lynchke is to say that with these data is apply for a grant to the Office of Violence Against Women to take the empirical research and translate it to a curriculum on victim notification protocols. And so we are awarded that grant, and we'll be working on that for the next couple of years. So in addition to the research reports that we'll be putting out with the Houston team on our website, we'll be working on that specific report for a national protocol on the how-to with regard to victim notification. So I'm going to turn it over to Chief Lynchke so she can give the more overview for the Houston project.
Everyone, Mary Lynchke. I'm an Assistant Chief with the Houston Police Department. I've had the honor and pleasure of being part of the Houston Grant Project involving sexual assault kits since its inception in April of 2011. And I spent a few minutes today to visit with you on the law enforcement component and our efforts to not only address the issues involving sexual assault kits, but how changed the culture of our sex crimes investigations. Everybody hear me, I hope?
Chief, yes, we can hear you.
Good, I just couldn't tell.
Yeah.
I'll get started, and I want to start by giving you a quick review. My slide's not moving. Hang on.
Hi, this is Jessica at the Ash Center. If you click on the slide and then use your arrow buttons to advance them, that should work.
There we go. Thank you. All right, we'll get started. I'm going to give you a quick overview of what I'll be presenting to you today. I'm going to talk about a little bit about the background, an idea of the sexual assault kit issue that was faced in Houston. I'm talking a little bit about the project research that we engaged in to understand and explore the law enforcement issues. A little bit about the role of law enforcement involving the untested and unsubmitted sexual assault kit that we had. And then talk about the impact on law enforcement in response to the results that we're going to obtain from the sexual assault kit screening. That was a big concern for us, that once we had these sexual assault kits tested, how was law enforcement going to respond in terms of the results and looking at the investigations? And then I'm going to talk a little bit about how we had to move beyond just the sexual assault kit. And this is really where we made our effort to change our culture to improve and enhance our investigative responses to sexual assault. So get started. Background, as everyone knows and has said a couple of times today, we received the grant from AJ in April of 2011. At that time, once we got that grant, we took a look at the number of sexual assault kits that we had stored in our police property room, and you can see the number was a little over 16,000 kits that were stored there. We started digging and trying to determine how many of those kits had never been submitted for testing. What we found is that a little over 4,000 had not been submitted by an investigator to the crime lab for testing purposes. And we also found that the majority of those that not submitted had occurred prior to 2006. And I'll explain that particular in the sand as to why 2006 was a little different. And just to give you a little tidbit, our oldest sexual assault kit in our property room was January of 1982. So you can see how long we have been collecting and storing sexual assault kits within our property room. The research, you can see the list there, the number of things that we did, and by means this is all-encompassing in terms of the information we gathered, interviewed, surveys, the data. We many more things than just this, but some of the more important pieces that we focused on to get our information, to figure out what was going on with our sexual assault kits and what were we doing with those investigations. And so one thing learn from all of the research. Well, of course, everyone wants to know, and as did we, is why were the sexual assault kits, why were sexual kits never submitted for testing? And what we found is that the decision to test a sexual assault kit lied primarily with the investigator. And again, that's up until 2006, investigator made the decision on what the kit was tested. But that investigator had some other factors to consider when making that decision. They had to look at the case components. What were the facts of the case? Was the suspect known? Was there a consent issue involved? Things of that nature. The technology available at the time. Prior to DNA coming aboard as a fantastic process to identify the DNA, prior to the technology was minimal. We had we have a known suspect to make comparisons. When D did come on board, then we had to look at crime lab resources, the staffing, the equipment, things of that nature. So that was an issue for the investigator to consider as well. And the cost. We did not have the money, once DNA was available, we did not have the money to send out kits. So hence, when we submit kits for testing, and crime lab had resource issues, we developed the backlogs within the crime lab. So all those components played a role in determining whether or not a kit was submitted, testing, and if it was submitted, whether or not it did get tested. So we knew why the kits were not being submitted for testing and why kits were untested when submitted to the crime lab. So what I wanted to do is look at the impact of the sexual assault kits being tested, especially the impact on the investigative response. Already randomly identified over 500 kits to be tested as a result of our project, and we knew we were going to have to engage our investigative resources to address the results of the analysis of those kits. We have an idea at the time of what the impact was going to be. So a quick shot to get an idea of the resources that we need for investigative purposes. So we took a sample of cases in which we knew the screening results of the sexual assault kit. We knew from the screening that the crime lab did whether the kit was going to test positive DNA or test negative for DNA. And we focused only on cases involving adults that came with more issues than cases involving juveniles. Adult investigators are going to involve consent, credibility issues, and those issues you don't generally find in the of those cases. So we took a rate of 259 cases, and those cases came from 2002, 2003. Those were closest to the expiration of the statute of limitations. We had an assessment conducted by our adult sex crimes investigators to look at those cases. What we were looking for was a guide from the screening results of the kit to determine what was the follow-up that was going to be needed to further investigate the case. So what we found from the assessment by the investigators was very surprising that 95% of the cases sampled could forward from an investigative perspective, regardless if the screening outcome of the sexual assault kit was positive or negative. Investigators' opinion, the majority of those cases they reviewed, they felt like there was no more investigative merit to continuing the case. And of course, we didn't know why the investigator believed that to be true, especially if there's going to be a positive outcome, a DNA outcome from the sexual assault kit. It's what really surprised us. 70%, almost 71%, we found the investigators believed that the victim did not participate, would not participate in the investigative process. Then we have 13% were, and it kind of attaches itself to the 20% issue, in that the victim failed to provide us a sworn statement, which the prosecutors in Houston liked that sworn statement before even considering moving forward with the prosecution. So if you look at that, that's almost 3% as to why the investigators felt like the cases could not move forward. And I'll put others up just to give you an idea of what the investigators saw. But our concern was, and what the information told us, is that our investigative efforts involved much more than just a sexual assault kit analyzed, because even if it was positive, the investigator did not think it would move forward as a result of assessment of that case in terms of the victim's participation in the investigative process. So we look beyond and move on just testing the sexual assault kit to address the issues we were seeing within our investigations so we could make that sexual assault kit more meaningful in terms of the forensic evidence it would provide for us and the ability to move forward and potentially get a judicial outcome from the case. So what we did is we recognized we needed to improve our investigative response in order to encourage and facilitate the victim to stay engaged with that investigative process. And that goes back to the piece that Noelle just talked about in terms of being focused on the victim. And so from an investigative standpoint, we looked at our investigative strategies, our operational issues, victim notification, and I won't go into that since Noelle's addressed those issues, how we viewed victims, how were we treating our victims, the advocate piece, and the investigator training. And one of the things we realized about the training is that investigators, specifically our sex crimes investigators, received a lot of good training. They didn't get a lot of specialized training in victimology, in handling victims of sexual assault, looking at how to investigate sexual assaults, what were things we could do and not do. We started our investigators to conferences. We started sending them to training, and we had speakers in, such as Dr. Campbell, who spoke to you a little earlier. We brought her down to Houston to talk with our folks. And it was more than just our investigators. We brought in everybody who had a role in sexual assault investigations, whether it be trained nurses, the prosecutors, the advocates, because this is not an exclusive law enforcement issue. This is a issue that involves a wide range of services, a wide range of partners, and this is one of the things that we had to do to incorporate and embrace those partners and bring them in and really focus on the victim and what we wanted to do. And of course, we couldn't do this without the department support. We've had tremendous support from our police chief, Charles A. McClellan, Jr., and allowing us to focus on these changes and make these changes. We had consistent messaging to our investigators about the direction we were going in and why. We had strong leadership to facilitate that messaging and ensure that we were doing all the things we needed to do in order to work with that victim and keep that victim engaged in the process. Of course, the communication and collaboration for the whole picture with all our partners to work and work together to focus on them and do everything we could for that victim. And really, the two key components of that whole series there is the victim notification and the justice advocate piece. So that was really the center for us in terms of changing paradigm from traditional investigative practices and strategies to that victim-centered approach. And I'll give you just kind of a quick update on a couple of things that impacted us during the course of this project, just to give you an idea of some of the things that we ended up having to do and realize it until some other decisions have been made. Our legislature in September of 2011 passed a state law indicating that in we collect a law enforcement agency, we have to now submit to the crime lab within 30 days for analysis. So the backlogs, the untested kits, that issue should not occur again, at least within the Houston Police Department, because we are very conscientious about this, and we've got a process in place where now we are doing it on a regular basis, so we should not incur any more of the backlogs or the untested kits. February, a couple of years later, February of 2013, the citizen made what I think was a very courageous decision and agreed to test all the tested and kits that we had in our possession. So that was all the kits that we found in the property room that had never been submitted for testing, all the crime lab that had been submitted for testing but never tested, and then incorporated any sexual assault kit that we obtained during the 2013 year was also going to be part of that outsourcing to get everything tested and done. We incorporated all the non-sexual crimes involving any kind of potential DNA evidence. And see, we spent $4.4 million to do this, and we sent roughly over 9,000 sexual assault kits to the vendors, outsourced them to get the results back. And the contract, just so you know, indicated that it would have a one-year turnaround. So we didn't have much time to put our resources together to start dealing with all of these cases. So you can see where we cleared the property room, we cleared the lab. Our backlog now was going to fall within the technical review by crime lab for when we start getting the results back from vendors, and then the investigative case review was going to have a backlog because we don't have enough resources to go to the cases. But what we do, and one of the decisions that was made and was supported by our department was we were going to touch every case. So if each case came back with a CODIS hit, or if it came back, if the assault kit results came back negative, we were going to touch that case. We were going to update that information in each individual report with the results of the sexual assault kit, and we're going to that case one more time to make sure there was absolutely either nothing we could do, or if there was something more we could do, we were going to do it. And so we made the conscious decision to review and touch every one of those 9,000 plus cases to make sure that we looked and gave it one final review to determine whether or not we were going to be able to do anything with those cases. Now, CODIS hits, when we got the CODIS hits, we want to work those cases as quickly as possible and determine exactly what we had and what we could do. So the department, again, provided additional support by providing the Special Victims Division permanent and temporary investigator staffing. So we were able to create a CODIS squad, and the squad has investigators that handle only the CODIS hits that come from these sexual assault kits, and look at those cases and work those cases to make sure that we are doing everything we can and facilitating those CODIS hits. And this is, again, where the victim notification comes in, because the investigators who are working that CODIS squad are going to notify that victim and reach out to that victim and look for that victim and determine what can we do to improve and facilitate the investigation of this case. So the victim notification protocols that Noelle talked about are implemented, and we are using those protocols every single day. I also mentioned we created the sexual assault information line to provide a mechanism for the victim whose kit did not come back with either with a positive response. It's either negative, or maybe the information, the evidence contained within that kit was not eligible to be entered into CODIS. So we wanted to provide a mechanism for victims to reach out, and again, that's based off the research from the victim notification piece that Noelle talked about, that so that we have a way for victims to reach out to us, and we could sit down and talk with them, but they would have that power to decide if that's what they wanted to do and want to know. So one of the things we're doing, I can tell you, we're about halfway through. There's been about 4,500 cases so far that have been touched, if you will, where the information from the sexual assault kits has been updated, and if it's been involved in a CODIS hit, then we reached out to that victim to determine how we are going to move forward with the information, and if we needed rest, or is it just a confirmation hit. So we work all of those cases, but we have a way to at least provide some level of information to those cases that did not result in a CODIS hit. So that's a real quick overview from the law enforcement perspective. There are more details that go in behind all of everything I've told you, but give time frame, don't have enough time to really go into that much detail. But we have our website that if you have an interest, we have reports on there. We have our point presentations, and you can go to that website to take a look at what we've done and how we've here in Houston on the project. So thank you for your time, and I apologize for going over a few minutes, but thank you for participating today.
Okay, all of our panelists for their presentations today, and now we're going to start doing question and answers. If you haven't had a chance yet, you can use the question and answer tool at the bottom right-hand corner of your screen on WebEx to submit any questions. So I'm going to start off with a question for the team that came up. It was for both Houston and Detroit. What types of obstacles did you encounter when conducting the audit of the kit? If you could talk a little bit more about that process and any type of obstacles or barriers you encountered when you were doing the audit.
This is Rebecca. I'll be happy to talk about some of our experiences in Detroit. Primary difficulty was lack of IT infrastructure. So we had a list of kits from the property system. We were not sure how accurate that was. We had an Excel spreadsheet testing status that was also incomplete. So for us, we had to bring the kits out one by one, count them. The counting was done by members of the prosecutor's office. You saw folks there in the picture. Those were off-duty attorneys and interns who counted them one by one. We collected some basic information from the outside of the kit because the inside of the kit cannot be opened during the audit. The chain of custody intact, the property officers had to be physically present at every time a kit was touched and any time a kit was being loaded in or out of property. So it took a great deal of coordination between the Detroit Police Department, who was very receptive to this and making sure that their property officers were available, and staff in the prosecutor's office to count the kits. So primary challenges were the IT infrastructure and just having the people power available to count all the kits. It took us about 15 weeks to do the complete census, the complete audit of all kits and property.
Noel, do you want to talk about Houston's experience with audit?
Sure. This is Bill. I'll briefly talk about the audit process that occurred in conjunction, but also outside of our project. So the Houston Police Department took responsibility for conducting the audit of their property room, which entailed an audit of their sexual assault kits. The research team was not involved in that process, so this was a task that the Houston Police Department took on their own. The folks involved from Houston PD are really better able to answer this question, but we were able to understand some of the things that they were doing when they did the audit. And one of the challenging components that APD faced was implementing some basic key pieces of information about investigation in each of those cases. So one of the very ambitious things that HPD did was opened up all of the investigative files. They were electronic. They opened up all the electronic files that were associated with each one of those kits, and then they pulled out and extracted key pieces of information about those cases that allow them to better understand possibly why the kit wasn't submitted for testing at the time of the original investigation, or what barriers and facilitators might exist when that kit would get tested later on. So this presented a challenge because that is a tremendous workload to go through and peruse several thousand investigative case files. But it was a very important and necessary step because it provided the department and investigators and then potentially the lab and prosecutors with more information about the context of that sexual assault kit.
Becky. Another question, or actually a series of questions, has come up relative to victim notification and both kind of anonymous kits, but also if a victim's not willing to make a police report or have their kit tested. And if you could talk a little bit about how those were handled in your specific jurisdictions in terms of go a bit more into detail in Detroit about the victim notification, and kind of you develop any protocols for handling victims that did not want to go forward with their cases, or handling anonymous kits in the future.
This is Noelle. I'll talk about that a little bit from the perspective of going forward. We don't have any anonymous cases in the data set that we have. In the state of Texas, we have non-report sexual assault availability, and those cases are SANE nurses. Those forensic data are collected by SANE nurses, and they're held by our Department of Public Safety. And we do have a different research report on our website about that. The protocols, who handles it, and then what we call in Texas how it's converted. Once a victim has 2 years to convert a case, which means to bring it back into law enforcement's purview or portfolio to formally report it. So it wouldn't be, at least in the state of Texas, it wouldn't be known to law enforcement until the case is converted. So it would be known to the sexual assault nurse examiner, but not to law enforcement until it's converted. And our website has our research on that. And we've published a paper on it too. So non-reports in our untested kits. I'll let Bill confirm that, but
Isn't something that we measured, Noelle.
yeah. Because by definition, they wouldn't be in there, I don't think.
Okay, do you have anything to add to that?
Sure. With regard to the Detroit site, important for us to distinguish what is happening with kits now versus what was the state of law with regard to the older kits. So from this point forward, if a victim has a medical forensic exam and he or she decides that they do not want to release the kit for testing, it's held on to by the healthcare facility, and the amount of time that it's going to be held is still to be worked out. We're trying to figure that out at the local level and the state level. There are some, if you will, regarding some other laws in Michigan regarding evidence and medical facilities and the like, so we're still trying to work that out. The goal is that if a victim decides she or he does not want to release the kit for testing, that the kit could be held for about a year, but to be determined, okay? So don't quote me on that yet. Issue of the past kits, though, the kits that were found in police property, the way the kit consent forms read at the time, the victim released the kits for testing. The police didn't submit the kits for testing. So those kits can be released for testing now because of the way the consent form read at the time. So when we've gone back with the money we received in the State Attorney General's office to test those old kits, we do that because we have a consent, we have a release from the victim to do so. In terms of notifying victims, in the interest of time, I did not get into a chance to talk about the Detroit Victim Notification Protocol, but I share a few key pieces here. It is a victim-centered trauma-informed protocol. At this stage, we are only making active notifications to survivors in the event that there's a CODIS hit. We're working on mechanisms where victims could reach back to us to find out the status of their kits. The notifications are done after there has been a multidisciplinary review of the case, including community-based advocates, system advocates, health practitioners, law enforcement, and prosecutors to make a decision to notify the case, notify the survivor. It's important to note that we did not take what written in the police report regarding complainant refused to prosecute as a criteria for whether we would notify. In other words, if when we pulled the old report that said complainant refused to prosecute, we not put that file aside and say, oh, well, no point in notifying this when complainant doesn't want to prosecute. The reason why is our research was very clear that that designation complainant refused to prosecute, complainant unwilling, was unreliable and often inaccurate representation of the victim's wishes. It was something that law enforcement often wrote to triage a case, to kick it off, make sure nothing happened with it because they didn't believe the victim. So given that, we did go back to talk to victims who were ostensibly not willing to prosecute, and that by and large they were willing to prosecute. So again, confirming our other research findings that the complainant refused to prosecute designation was likely unreliable and invalid. So we have been able to go back to survivors, work with them with an investigator affiliated with the prosecutor's office and a community-based advocate to provide information about the kit that was not tested, to let them know it has been tested, to offer an apology to the victim that it was not tested, and to sit down and explain the results and to talk about next steps. And we know that most of the victims, the vast majority, approximately 70%, are saying, I do want to do this. I want to go forward. I'm so glad that you contacted me. I want to move forward. The remaining ones have said, I'm glad to know. Thank you for knowing, but given where I'm at in my life right now, I don't want to move forward. That choice has been respected because it's a victim-centered approach.
Thanks, Becky. So now kind of a question probably for Noelle and Chief Lenschke is there's some police departments and advocate groups that are asking about implications of these two projects for rural areas. So Houston and Detroit are both urban areas. So are there any lessons learned or even partnership ideas you have for areas that might have much less staff, less kits, and kind of more land to cover for this sort of issue?
Go ahead, Chief Lenschke. A resource issue, I think, for police departments. Do you want to take?
I'm trying to see if I'm on or not. Hear me?
You're on. You're on.
Yes?
On.
Okay. It's going and forth here. I think a lot of the issues can be the same. It's the whether it's a rural area or an urban area. The rural area obviously is not going to probably have as many of the resources, but the resources that are there with the can be engaged if there's a willingness to engage in those partnerships, whether it's between law enforcement and the hospitals, law enforcement and the advocates that are in and around the area. The resources that are there for the victims. I think it's a matter of the level of engagement and the willingness to engage between involved process of assessing and handling a victim of sexual assault from that moment of outcry. So I think it's possible. I don't think it's limiting, but I think some of those efforts are still possible in rural areas. In terms of processing the sexual assault kits, and obviously that's going to be unique to whatever regional crime lab that the rural area has in terms of that piece of forensic evidence. But I'm very much a believer that things are possible, even in rural areas, to address these issues and put the victim at the center and make at the center of the investigation and at the center of making sure that they are taken care of and handled with dignity and respect in terms of investigating their issue.
Thanks, Chief. Also, so kind of along the same lines, some questions have come up related to the resources. I mean, I think everyone knows that these two projects were funded partially by DOJ, but you also leveraged other resources. But kind of how resource intensive was this undertaking? And if you have any information related to cost and resource allocations that your various departments and partners put forward.
Well, this is Noelle. part of the Houston work has involved a deliverable around economic analysis. So that will be part of what we produce and will be available on our website in the short coming months. So we will have some specifics about that.
In terms of, and so from that, aside from the cost piece, obviously, that Noelle just mentioned, the support we received from the police department and its willingness to do anything and everything we could to address this issue of sexual assault kits. And that's where Houston wanted to go above and beyond just testing the kits and just addressing those results involving kits. We had to provide an opportunity for all the victims, every victim that had a sexual assault kit done, to provide with an opportunity to find out about their case, to know about their case. And that required a lot of resources because in addition to all of the 900 plus sexual assault kits that pretty much have all been tested and are all back in our shop, and like I mentioned earlier, we're about halfway through touching about 4,500 of those cases so far. But to that because we felt like we needed to do that for the victim, and we had to leverage a lot of resources internally, and the department supported us in that by providing us not with additional staffing for the Special Victims Division. Because you have to keep in mind, we're still having current cases come in and have to be investigated. So not only did we have all the backlog cases and the tested cases coming in, but now we have also the current cases that we're dealing with every day. So we have tremendous workload ahead of us, and we had to have that staffing. And the department was very supportive in providing us with that staffing to get those done. And this is, I can tell you, this is not something that has ended with this. This is going to be something that's going to be ongoing for a while, and we still have a lot of work ahead of us. But yes, it's been supportive. That's been a blessing here in Houston.
Cindy, this is Bill. I'm just going to follow up on what Chief had to say by also indicating that, this is one of those issues and areas where, the diagnostic component of our research model can really be important. So if a local jurisdiction is considering exploring this, they think they've got a problem and they want to look at it, but they're concerned about resources, I would encourage them to think about engaging in sort of this diagnostic process, bringing some of the local stakeholders together, trying to assess the problem, and then systematically work through the kinds of resources that already exist, and then try to understand where there are gaps in resources. And then that'll allow, it makes it less daunting, because I think then the jurisdiction can begin to understand what they have and what they need, and can move forward in specific areas to build on what they have and find ways of filling in those areas of need.
This is Becky. I'd like to chime in on the Detroit project. As many of you know, Detroit has been a very resource-strapped community. The city filed for bankruptcy in the middle of this project. So resources have very clearly been an issue for Detroit. We were able to test the kits in this project, combining funds from a different NIJ funding mechanism, DOJ backlog reduction grants, and then monies from the Sexual Assault Kit Action Research Project. The money to test all remaining sexual assault kits that were found in police property came from our State Attorney General's office, and that was through settlement money. So we encourage jurisdictions to partner with State AG's office to see what sorts of settlement funds they might have available to support testing. In terms of funding for prosecution, for victim advocacy, for law enforcement, here Detroit had a very innovative idea of working with a nonprofit organization, the Detroit Crime Commission, a 503c3 organization that was allowed to do fundraising for us. So they have been able to leverage private resources, public partnerships, corporate sponsorships to funnel money to the Detroit Crime Commission, which is then able to work with the different organizations in Detroit to support testing and the staffing resources that are necessary for the continued investigation, prosecution, and victim notification of these cases.
Great, thank you all for those responses. So the next question kind of brings us to this area of investigation and prosecution. So based on what we've heard, some preliminary results is if you all could give us an update on what's happening now in terms of the investigation and prosecution of some of these kits that did get a CODIS hit or that might be moving forward for prosecution.
This is Becky. I can handle that question quickly and then kick it over to my colleagues in Houston. In the context of the Detroit Action Research Project, the investigation and prosecution was outside the scope of my research, so I do not track that information in this research project. I can say that every case that went to the Victim Notification Review Team has been investigated, and as many as possible are moving forward through prosecution. They are being very aggressively pursued within a victim-centered, trauma-informed framework, but that is not something that's within data set that I have available.
This is we tracking to a degree the investigation and prosecution. It is, you know, as with anything, the prosecution piece is always takes a little longer to follow from the investigative piece. But we've had probably 1,000 CODIS, but that we have only had a handful of charges. Less than 25 charges have been filed. Most of those are on individuals who are already in prison. Some of those less than 10 new arrests, and we're, as far as track, I don't have specific numbers. As far as the prosecution piece of that I don't know if we've been able to prosecute anybody with charges yet. My thinking is the cases have not gone to court, but I don't have any information on the prosecution piece. But we've only had a handful of new charges filed on someone. Generally, they were identified on the investigation previously.
This is Bill. I just want to follow up on one of the things that that said, and you know, as we track these CODIS hits and find out what happens in the investigation and then prosecution, you know, we're already learning some things, and one of the things that we're learning is in a good chunk of these cases, the statute of limitations has expired in the case, or the person, you know, is incarcerated currently. So what some of our CODIS investigators or some of the CODIS investigators at HPD are doing is finding alternative ways to use these CODIS hits. So in certain situations, the CODIS hit is being used to build a case that would deny parole, for instance, from somebody that might be released from prison soon. Even though that case may be out of the statute of limitations, investigators are still finding ways to use that evidence to hold offenders accountable.
I just might add, this is Nell, that in conjunction with that justice advocate, because she is embedded in the unit, also looking at, from a procedural justice standpoint, how justice can be served, not just from a prosecution standpoint when those options are not there. And in these untested cases, that might be more probable for survivors or victims. So what are the ways in which criminal justice or justice can be redefined for victims? And Becky said something that is really telling. An apology, of them feeling heard the second time around, at least our research has shown that has made a big difference. So being heard, being treated differently the second time around, even if the case can't go to prosecution because of some of the things that Bill has said, can bring healing in ways that are very important for sexual assault survivors. So not the way that we want to go forward with cases, but certainly retrospectively, that's been an important piece of the shift that the chief has talked about.
Thank you. So we're to the end of our time, and I have one final question for each of our panelists. So what is the biggest change that you've seen as a result of this action research project within your respective jurisdictions?
From the Detroit site, I'm gonna have to cheat. I can't say single change singular. It has been what's powerful about this project was the set of changes that happened. It was change within sex crimes unit to think about investigations differently, to move forward with evidence-based practices, to get crime staff trained on the neurobiology of trauma and victim behavior and how to work with victims in a state of crisis. It was the decision to form a policy to test all kits. It was the decision to come together as multiple organizations to create a state law so that all kits released by victims need to be tested. It was the recognition that the community has not been doing a good job with sexual assault, and a commitment from all of the organizations to say, we can do better, we will do better, we will make this a very different experience for survivors in Detroit. So it really was a set of changes that were all very much interrelated to each other.
That's exactly ditto for Houston. I don't want to speak for Bill or Mary, but I think that's the process that action research can bring to you. And it has not always gone smooth. 4 years and getting to know each other, we also often align it to being married, that we're going to have our disagreements, but we've stayed married to each other. You know, we've every month gotten together as a working group and set out a plan of what we're going to do next. And sometimes it's been hard and sometimes it's been contentious, but we have stayed the course of making these changes. And then we've had champions come along like Chief Lynchke. I think one of the things that we've seen was they shifted when I felt like I could almost see the change come when we got our champion, and it pivoted, and things started to move pretty rapidly. But it was not always smooth. But we decided we were going to stay in it. It would have been really easy to leave that process. So the support from at national level and every level to stay the course has been really important for that. And Houston's better for that. And hopefully at this point, back way up to prevention at some point in the city of Houston ahead of this crime.
This is Mary. I agree wholeheartedly with what Dr. Campbell's assessment of the issue and with what Noelle just said. And I agree with all of that and support all of that. And the thing I want to add to that is the fact that I think one of the biggest keys for Houston is the fact that we have communicated. And as Noelle said, it's been a little rough at times, but we get an environment where we could say what we thought and put our ideas and discuss and look at what were we doing, how were we doing it, and could we better? And not just from a law enforcement perspective, but from the advocacy perspective, from the scene nurses, from the hospitals, from the prosecutors. What could we do to do more and more and more for that victim to help them with the process that follows that horrific event in their life? And that's the perspective we took, and the communication we had to do that, and the willingness of everyone at the table to do that was the biggest to me, because without that communication, without that honesty, with putting out those ideas, I know we would be where we are. So that, to me, has been one of the most fantastic things about this process, because I understand more now about all the partners and their roles and how they impact law enforcement, and how law enforcement impacts what they do. And without that effort, without the level of commitment, I know where we would be. So our multidisciplinary approach to address this issue and and set holistically was absolutely incredible for the Houston team.
This is Bill. Yeah, I think we all agree, at least on the Houston team, that the working group was a key part of the success. And I'll tell you that our working group made the decision that once this grant funding runs out and our project kind of officially comes to an end, that the working group is going to continue. And we're still going through the steps of figuring out this working group is going to look, what vision in the city of Houston it's going to be housed under, and so forth. But I'll take a slightly different approach, and I'll talk to you about one specific change that was made as a result of this project that I see as being particularly valuable, and that's the hiring of the Justice Advocate by HPD. So very early on in this project, a few of my graduate students interviewed all of the sex crimes investigators at HP, and one of the things that we learned about in our interview protocol was how they collaborate with victim advocates when investigate cases, and their views on that. What are the strengths and what are the weaknesses? And we learned that very rarely did investigators work closely with an advocate during the investigative phase. They may have worked closely with an advocate in terms of victim compensation and victim compensation paperwork, and investigators refer victims to services, but they didn't collaborate closely with an advocate. And our working group discussed this, and we discussed it a great deal about what this meant, should this be changed, and then how should that change look. And we to the point where we decided that we hire a victim advocate, and she would be housed within the sex crimes units, now Special Crimes Division in HPD. And I think that's been a very tremendous positive change. This isn't nothing new. Other departments do this. We don't know how many other departments do this, but we know some other departments do it. It's a great success in HPD, and they're looking to expand this. I mean, grant funding for the position was very short, and then HPD picked up the funding, and now there's been talk about creating an additional 2 or 3 more advocate positions in HPD. So, in terms of a specific change that was made, I think that's pretty darn significant.
Great. Well, I want to give a special thank you to our panelists today. This was an excellent webinar, and I thank you for everyone participating across the country and the world. We have several international participants. You will be receiving some information from the Harvard's Ash Center in the next week with links to the audio recorded webinar, as well as slides and some additional resources that we'll be sending out with hyperlinks. I want to thank you again for your participation and hand it over to